Let's talk more about this bill and much more with Ohio Democratic Senator Sherrod Brown. Senator, we thank you so much for joining us this Saturday. A lot of critics have argued that this repeal and replacement bill was crafted in secret. It was finally released Thursday. I want to get your initial thoughts after taking a look at it.
Sure. Thank you, Maurice. The fact is, this was done in secret. It was done with very few senators in the room. I've heard lots of Republican senators complain about that. Add to that the fact that there were drug company lobbyists and insurance company lobbyists and medical device company lobbyists in the room writing this bill, and you end up with a bill that, number one, we talked about opioid treatment a few moments ago. This takes away the number one tool for states to deal with this terrible epidemic. To my state alone, 200,000 people right now, 200,000 people are getting opioid treatment because they have insurance from the Affordable Care Act. And if this bill passes in anything close to the form it's in, it will just pull that treatment away from them. And where do they go? What happens to these families that have already been turned upside down because of the addiction in their family, and this just makes it worse?
Now, you actually wrote part of that in a statement you released, writing, quote, "This bill takes away the number one tool we have in the fight against opioids, Medicaid treatment, I should say. We cannot allow Washington to rip the rug out from under Ohio communities." I should point out your Republican counterpart in Ohio, Rob Portman, also said he cannot support a bill that does not contain opioid funding. This problem has grown exponentially over the last decade. There is no doubt that this is a crisis. I believe this year alone, more Americans are going to die from opioid overdoses than Americans that were killed in Vietnam, Iraq, and Afghanistan combined. Why is that? What more could have been done to prevent us from getting here?
Well, that's a whole much more complicated question. There's no question that our society didn't see this coming to the degree it has. It's in part, I mean, there's a whole host of reasons. One is levels of unemployment and hopelessness in lots of communities. We've seen it hit the hardest, mostly where the unemployment levels are hardest and wages have been stagnant. We saw too many cases where doctors and pharmacists would prescribe too many of these. People were pharmacy shopping and doctor shopping. We saw the drug companies peddle these without not always honest about how addictive some of these substances were. There's a whole host of reasons, but the last thing we should do is a bunch of elected officials who have insurance themselves voting to pull insurance away from these 200,000 people in my state. Many of them have jobs. They just have jobs without insurance. They're $8, $10, $12 an hour. They don't have insurance. They have nowhere to go except to get this treatment, the counseling, the medication-assisted therapy, all of that. I ask people to come to my website, sherrodbrown.com, sign up to preserve our health care. This is just unbelievable to me that this many politicians who have health insurance provided by taxpayers would take it away from so many others.
Well, Senator, the argument from the other side is that this is ultimately a law enforcement problem, not a health issue. And the belief of many of your political opponents is that this is, for lack of a better phrase, a personal problem. How do you convince them and taxpayers that they should pay to help people that are abusing drugs?
Well, first of all, the law enforcement people I talk to say I was with the head of the Fraternal Order of Police in Cincinnati. I watched a hearing that Senator Portman and Senator Carper did I believe it was Senator Carper with Senator Portman, where a police chief from Cincinnati area was in, the coroner in Cleveland was testifying. They all said if you can't take Medicaid away, it's the only chance to help people. Our society, this is too widespread to point fingers and say, well, somebody lacks character or somebody else is weak. This is a public health issue. We've never seen anything like it. There are 200,000 people, as I said, right now in Ohio getting opioid treatment, getting medication-assisted therapy, getting counseling, getting prevention and other kinds of help. It happens to people from all socioeconomic backgrounds. It happens to people, younger people more, but people of all ages. And for this Congress to turn its back on this public health crisis is damn near criminal.
Now, sir, Senate Majority Leader Mitch McConnell, he's trying to get this vote done before the July 4th recess. Do you think he, first off, makes the vote happen? And do you think he gets the votes?
I have no idea. I know that Senator McConnell is enlisting his drug company lobbyists, his insurance lobbyists, the people that helped write the bill. I know he's helping them getting them to put pressure on members of Congress and all over. And I know the sooner that you keep in mind, McConnell did this in secret. The reason he did it in secret in his office with these lobbyists was he knows the more light that shines on this bill, the more sunshine in the room, and people understand what's in it, and the public understands what's in it when Congress actually has a chance to read it. If we have enough time to do that and debate it and have hearings, the more people won't like it. That's why McConnell is trying to jam this so quickly. We've never seen anything like this on any important issue like this, where there's no hearings, there's little debate. Lobbyists wrote it in the back room. Almost no senators and no Democrats were involved, and only a very small handful of Republicans, even Republicans that were advertised as being in this group of 12 or 13. Some of them told me they didn't have any real input and they didn't really know what it was, because it was written by drug lobbyists and insurance companies and people who will get tax breaks. Don't forget, this is a bill that's got an $800 billion tax cut in it, mostly for the wealthiest people in the country and those interest groups. For instance, the 400 richest families in this country will get a $7 million each tax cut. At the same time, they're taking insurance away from people making $12 and $15 an hour that are struggling but don't have insurance through their employer. What kind of country, what kind of people would do that in Congress?
We will certainly keep a close eye on the Senate floor this week, not just for a potential vote, but also to see if this bill will address the opioid epidemic. Ohio Senator Sherrod Brown, we thank you so much for joining us today.
Good to be with you, Maurice.